A day after the Union Health Ministry raised an alarm over COVID testing numbers in Delhi, Health Minister Satyendra Jain says Delhi is conducting the maximum tests in the country. In fact, he alleged that other states are not even conducting half the numbers that Delhi is doing. Yesterday, the Health Ministry had said that COVID testing in Delhi had plateaued in September, despite the fact that there was a massive surge in the number of cases.
आरटीपीसीआर की कम नंबर्स को लेकर कंसर्न्स उन्होंने
मुझे लगता है कि आपको मेरी बात या किसी और की बात पे नहीं जाना चाहिए। आप खुद पत्रकार हैं। पूरे देश में सबसे ज़्यादा टेस्ट दिल्ली में हो रहे हैं और कोई राज्य लेके आइए जो हमसे आधे भी कर रहा हो, कोई भी लेके आइएगा। अगर किसी ने कहा और आपने मान लिया कि दिल्ली में टेस्ट कम हो रहे हैं, जी नहीं, ऐसा नहीं है। दिल्ली में सबसे ज़्यादा टेस्ट हो रहे हैं और भी बढ़ाएंगे हम। देखिएगा, एक समय था 20,000 हो रहे थे, मुख्यमंत्री ने कहा नहीं 20,000 को 40,000 करेंगे, फिर उन्होंने कहा नहीं 40 नहीं 60 कर दो। तो एवरेज पिछले 2 महीने से लगभग 60,000 टेस्ट या उससे ज़्यादा टेस्ट डेली हो रहे हैं पूरे देश में। आप देखिए पर मिलियन टेस्ट, 3,000 टेस्ट पर मिलियन कोई भी राज्य नहीं कर पा रहा है, हम कर रहे हैं और इसको और भी बढ़ाएंगे। हम ये नहीं करेंगे कि इस पर हम रुकेंगे, हम इसको और बढ़ाएंगे।
My colleague Ayushman Kumar joining us live. Ayushman, will be running those graphics on our screens as well to show the level of testing that is happening over a period of, say, from 10th of November to the 16th of November. It is true that the number of at least the antigen tests have come down drastically. So for Mr. Satyendra Jain to say that we are doing the highest in the country, how convincing is that at this stage? Because clearly during the period of the festivities, the daily caseload had come down to around about 3,000 figure, which was much less than 7,000. But then we got to know that that was because there wasn't enough testing, which you also reported on, Ayushman.
It is very important to understand the fact that per million population does not represent the correct picture, because Delhi has got only a 2 crore of population, and if you see right now, Delhi will definitely have large number of people in that bracket. Currently, if you see the last 7 days testing, Delhi has conducted about 3.2 lakh tests. Out of that, if you see the overall scenario, around 1,20,000 tests are from RT-PCR, which is roughly about 38%. In that 38%, 65% of the total positive cases have come. From rest 62% of the antigen, only 35% of the positive cases have come. So it is true that more number of cases are getting detected by the RT-PCR, and that is why the center has been focusing upon increasing the number of RT-PCR tests. This is something which has actually left the Delhi government red-faced in the High Court as well. They have been slammed by the High Court as to why the RT-PCR numbers are not increasing. If the overall test scenario is to be talked about, the antigen number are always high. It is almost double that RT-PCR testing, whatever takes place in national capital, antigen is just double. In fact, yesterday 16,000 RT-PCR take place and 32,000 antigen took place. But currently, if you see the scenario, the center wants to increase the RT-PCR test and wants to have a rightful mixture of both antigen and RT-PCR. The Delhi government is saying that currently they are testing large number of people, but according to center, the cases plateaued, the test number plateaued in between September and October, and that is why large number of infection went unnoticed. And that is why number of RT-PCR has to be increased in the national capital.
Okay. All right. So I'm now going to go across to Tanima, who will also give us a perspective on this, especially with regards to RT-PCR versus antigen testing. Tanima, we want our viewers to understand that whenever we quote figures of, say, daily caseload or for that matter, the total number of cases, it always has to be looked at through the prism of how much testing is being done, like Ayushman also mentioned. Give us an understanding of the breakup that we are looking at. How many RT-PCR tests vis-a-vis antigen, and why does it matter?
That's right. In fact, as Ayushman was saying, that probably it's about the fine line and we have to read between the lines also sometimes, because it's not just about conducting the maximum number of tests as the Delhi Health Minister is claiming. It's also about the kind of tests that is being done, and that is what the center is raising an issue about. If we just look at the facts first. So this is the data that we have between 10th to 16th of November, where the number of total number of tests which have been conducted, out of this, the number of RT-PCR tests accounts for around 38% of the total tests. Antigen tests, on the other hand, account for the rest of it, which is 62%. If we look at the total caseload of cases which have turned out to be positive, in that the RT-PCR tests actually detected 65% of the COVID cases. whereas the antigen tests detected 35% of the COVID cases. So essentially what even the center for that matter and experts also point out is the fact that the RT-PCR tests are probably the tests which are able to confirm the cases properly, more effectively and more conclusively, whereas antigen tests are only going to indicate at antibodies. And as a lot of experts and health experts and doctors also point out, that after an antigen test, it's always better to get an RT-PCR done, just to be safe, just to be doubly sure. So the fact that there's a massive surge in COVID cases in Delhi, the fact that they have not increased the number of tests after September, and the fact that more number of antigen tests are being done vis-a-vis RT-PCR, these are some of the issues that Delhi government needs to keep in mind when they are chalking out their COVID strategy here on.
Absolutely, Tanima. Therefore, we are, looking at this issue more closely, because it's not just sufficient to talk about how much testing. It is also important to highlight what kind of testing, which Tanima just explained to us. Thanks for joining us. The Health Ministry earlier had also raised an alarm over the COVID testing rate in Delhi, saying that despite the surge in cases, there hasn't been enough testing, which is of the conclusive nature. Like RT-PCR is more of a conclusive nature than the antigen, where the margin of error is larger. The Health Ministry data on your screen, in fact, shows a plateau in testing between September and November in the national capital. And the centre has now directed the Delhi government to double its testing, because there are now real concerns on whether enough RT-PCR tests are conducted or not, or whether the dependence on antigen tests is much more in the case of Delhi. So I'm going to, in fact, be joined by Dr. Sanjeev Bagai, a well-known pulmonologist who's joining us this afternoon. Good afternoon, Dr. Bagai. If you can hear me, just wanted to get clarity. You've always helped us understand issues in the true perspective. And once again, we need your help to just help our viewers get an idea on why the RT-PCR tests are more important, more conclusive than antigen tests. Is that the reason why the Delhi government is being pulled up? That while you may claim to be doing a lot of tests, higher number than other states, what nature and what kind of testing is being done is also critical to get a correct picture. Dr. Bagai.
Right. Good afternoon. So just let me put the facts on the table. This debate has been happening worldwide for many months, and therefore the largest meta-analysis body of the world, known as the Cochrane trial, did a meta-analysis of almost 33 randomized controlled trials, which are peer-reviewed. And what they have published is that the rapid antigen test only picks up the antigen. It doesn't tell us anything about the virus. That's the first point. The second point is that the meta-analysis shows that the rapid antigen test in the peak capacity is only 56.5% sensitive and about 67% specific. That means there is a 1 in 2 chance of missing a positive or indeed missing a negative. Versus your RT-PCR, which is considered as a gold standard, it picks up the RNA of the virus. That means it tells you whether the virus is there or not, and it has a peak sensitivity and specificity of almost 85 to 90%. So therefore, RT-PCR is a better test to be done to diagnose patients with indeed COVID, and it is a better pickup rate, more accurate, although it may take a little bit more time as compared to rapid antigen. The second important point is your rapid antigen. The timing of this test is important. So if you do it too early or too late, you may miss a positive or a negative case. It is only used, your rapid antigen test is only used for triage. That means mass screening, not for diagnosis. It's for mass screening, I repeat, not for diagnosis. So therefore, we must rely on RT-PCR and for the present moment, no other test.
That's a very important point, Dr. Bagai. Like you said, the RT-PCR is for diagnosis, whereas the antigen is more for mass screening. But then again, like you also highlighted, the issue of accessibility, the issue of time. Do you think that this kind of dependence, because if we look at the figures in Delhi, at least 62% of the tests that are done are antigen tests. So the results that we have of the positive cases, bulk of it is through antigen. Therefore, is there a chance that there could be a lot of people who have gone undetected despite taking the antigen test?
Absolutely. I would totally agree with that. what in fact one of the shows last night on television, I had requested the art government that every art have community centers. The community centers from 8 a.m. to 8 p.m. should have availability of having testing facilities of RT-PCR, rather than patients getting confused which lab to go to and the reliability of that lab. We should have one centralized place in each colony, which makes it much easier. One is to access, two is to get the reports, and third is the reliability, accuracy of the test. It will become much more convenient for the residents, and it's something which is very easy to do. We can use the present facilities. So rather than reinventing wheels and patients traveling far distance and exposing themselves and others, it is within reach, within their local community, and the transmission and cross-infection rate would therefore obviously decrease.
Right, so that's an important point again, and therefore there is a bit of a difference of opinion right now when it comes to the Health Ministry at the centre and the Health Ministry at the state, where the central government has talked about testing hitting a plateau in the month of September, and also that the testing should now be doubled to 1.5 lakh per day in order to get an accurate picture, so that a precise COVID strategy can be devised. Dr. Sanjeev Bagai, I appreciate you joining us this afternoon and giving us your views on this.